Okay, I'll call the meeting to order. It is Tuesday, October 17th at 4 p.m. This is the Burleigh County Human Service Zone Board meeting. We'll start by, we'll just do roll call of members who are present.
Senator Dever.
Here.
Tracy Famous.
Here.
Leslie Piercy.
Here.
Trevor Van Nett.
Here.
And Director Flory.
Here.
And Galen Becker and Jim Holm are both absent.
Prior to that on the agenda would be the oath of office for Commissioner Bakken, but we'll wait and see if our elected official is here to do that. So we'll just move to the next thing on the agenda, which was the reappointment of our board members. So those members who were up for reappointment were Tracy Famous and Jim Holm. They both expressed interest on staying within this board, and I took that in front of the commission, and they did approve that reappointment. So you guys are reappointed to the board. That does not, no. They just get to approve them to be, correct?
Correct, yep. The commission has already approved their reappointment, so. And then I'll just add, Chelsea, for the record, that Galen Becker, I noted him as absent. He's present now.
Hey, Galen.
Sorry, I'm late.
You're okay. Next on the agenda was election of the vice presiding officer. So again, Commissioner Matthews was the vice presiding officer, so we can have discussion around who that vice should be. But technically, being you're not sworn in yet, you're not even on the board yet, so we can have discussion if anybody's interested in making a motion for the vice presiding officer. Really, it would be in my absence, duties such as this board meeting, but I don't see a lot of other duties outside of that, so.
I would be willing to, whether you don't want to.
Your absence at our last meeting, somebody suggested Tracy.
And I think when Commissioner Matthews was absent for different reasons, she did kind of have you fill in for that.
Yeah.
So you're pretty aware of those matters too, so. If anybody wants to make a motion either way, it doesn't matter to me.
I will move Tracy.
Second.
Okay, so we have a motion for Tracy to get on as the vice presiding officer in a second. I'll just say all in favor.
Aye.
Any opposed? All right, motion passed. Next thing will be the approval of the meeting minutes from August 15th, 2023 meeting. If everybody had a chance to review those, any comments, questions, concerns? If not, somebody can make a motion to approve those as well.
I would so move.
I'll second.
All right, got a motion and a second to approve those meeting minutes. All in favor for that?
Aye.
Any opposed? Motion carries.
Chelsea, can I interrupt you for 1
Yeah.
second before we move on?
Yep.
With Tracy being elected as vice presiding officer, she was previously board secretary. So we would also need to refill her vacancy as secretary.
Oh, perfect.
She certainly is.
I'll just take the one.
Okay, so Tracy, as the our previous secretary, then we'll need to fill that. So if anybody wants to make a motion for the secretary, I don't know, Tracy, I guess, what that entailed for you, if anybody had any questions, but.
Well, with Tay on here, it's very limited. I mean, she keeps everybody organized and so it's just mostly in name.
Okay,
I can do it.
okay. So you're motioning for yourself to, okay.
That's your secretary, you can record that however you want.
Do you have a second for that then?
I'll second it.
Okay, so you have a motion and a second for Trevor to serve as the secretary for this board. I'll just say all in favor for that.
Aye.
Any opposed? Okay. Okay. Next on the agenda was discussion for the 2024 board meeting dates. Tian had provided a draft of what those dates could look like. I wanted to have discussion around currently. They're held every other month. Those she left kind of as is at this 4 p.m. time. we could look at doing it quarterly. The nice thing about the quarterly dates is that, one, for your guys' time, to be respectful of how often you're having to come to this duty, but, like the March date for 2024 falls right in line to kind of talk about our fiscal changes that you could be seeing. The June date would fall right in line for director eval. So they just were good dates that they fell on. As far as 3 p.m. to 4 p.m., Jim isn't present, but he did say that he preferred the 4 p.m. date, but he's obviously not here, so he doesn't get a vote, so. Any conversation, or anybody want to make a motion for which way they would prefer to do the meetings?
Do you see a need, Chelsea, for more than quarterly? I don't see a need as much, I don't see every other month as necessary.
Yeah, I would agree. I think the quarterly dates were just fine.
I would move quarterly dates as presented on the calendar from 4 to whatever.
So you're motioning for the quarterly at 4 p.m.
Yep,
on those Tuesdays, okay?
yep.
Would the duration of the meetings change in, would they be longer going quarterly, or are we still expecting them?
And so that's why Tayan said maybe you want to do 3 p.m. If they're quarterly, are they going to be longer? But even when we meet in at 4, we're usually out of here by 5, so at the latest, it'd probably be like a 5:30. But you never know what the agenda holds, what people want to, yeah. So that was part of the reason why she proposed the 2 different times, being if it's quarterly, maybe we want to allow for more time.
You know, that might not be a bad idea, so we do, cause it all depends what you have on the agenda. You know, if you have topics like budget and stuff,
Mm-hmm.
maybe a 3 to 5 would be better, but I just don't know, cause every agenda is different.
So you could amend your motion that you would like it to be
Yeah,
quarterly on Tuesdays at 3 p.m.?
yes, 3 to 5.
Can I just ask, did Jim say he would be able to do 3 o'clock, or it'd just be easier?
He just said Tuesdays at 4 work fine. That was his response, yeah.
Okay.
He's a pretty flexible guy, but that's all he said was, he was fine with, the date that we had selected, and then at 4 o'clock work fine.
Regarding the 3 p.m. timeframe, in the past, we had our December meetings at 3 p.m. at times, just to accommodate schedules and whatnot, and that didn't seem to be a problem for the board members either, so if that helps your decision-making at all between the 2 times.
So we have our motion on the table. I don't know if anybody wants to second that, or,
I'll second it.
okay. So a motion and a second for the Tuesday meetings at 3 p.m., and we'll do those quarterly. All in favor of that?
Aye.
Any opposed? Motion passed. And Tayan was very proactive and made sure that those dates worked for Tom Baker, because this is a very used room, so she made sure that we could secure those dates. So again, if anything comes up and you're not able to attend, I have been trying to send out calendar invites for all of you, so you have them on your calendar. And just let me know if you ever can't attend, so I just have a heads up, but.
These are third Tuesdays of the month, and that works better than the second Tuesdays that we've been.
Yep.
For me.
Oh, perfect. Just for you.
The second
And that's
Tues-
what these are, the third Tuesdays of every month.
Well, and that works better for this room, because I know a couple times we've been up against it.
Mm-hmm.
Mm-hmm.
And
Yep.
I don't like that.
Yep, historically, that's what the Social Service Board has been, is the third Tuesdays of the month, so that's what we stuck with. We just varied the months to meet better quarterly cycles.
Mm-hmm. I would just say the only other thing for that with the meetings, if you guys ever have anything you would like on the agenda, just let me know if there's certain things you'd like to hear from community partners, or things that I can ask to attend, and you just kind of what you're looking for. We'll go over the reports that you get, and then some of the changes that we're making to these programs in our agency. And again, I'm always open to feedback for how those reports look and what you would like to see different out of them. So we will just go to agenda number 8, which is the economic assistance update. So couple things that have are different within economic assistance since we last met in August would be, right at that time, we spoke about this, I think, at our last meeting, but we were launching some of our eligibility workers into the call center to provide some support to the call center. So basically, they needed help with the number of calls that were coming in. There was data they presented on a number of missed calls, so probably more so for Commissioner and backstory. The call center went live beginning of 2023 as a statewide call center. So that was a change through Department of Health and Human Services to operate that way. And with that, they were seeing a large amount of calls that either weren't getting answered or long wait times for those clients calling in. So we did participate in rotating in staff. So what we did was have from August 14th through September 1st, we had 3 staff from one of our groups within our eligibility team go into the call center, and then they rotated back into their group, and then we had 3 additional people rotate in from September 5th through the 29th. And this was, again, to help with the call center efforts. This was not just our region. They were asking for these volunteers or us to identify workers who could do this based on group capacity around the state. Our region, and then again for probably more so Commissioner, is within the Dakota Central, 3 Rivers Human Service Zone, Rough Rider Human Service Zone, and Southwest Dakota. So that's your southwest region of the quadrant of the state. After that, I call it a pilot, or we operated that through September. About mid-September, directors were around the state were presented with the data of that work, and what it showed was, I would say, more calls being answered, so more support to the call center, and not a whole lot of impact to backlog being created by pulling those people out of those groups. There's different variables we talked about, whether that was the timing of that, and we get into like LIHEAP season really is kicking off right now, but at that time, maybe they had the capacity to help with. So we had good conversation as directors regarding all those staff that had volunteered previously were pulled out of what we call Group 4. So they are our TANF workers around the state. So what we discussed was moving that effort to the other 3 groups as well, Group 1, 2, and 3. And so we've been identifying workers to continue to rotate in. So this was extended into October after that data showed relief to the call center and not a huge impact to the work that they were doing within our region. Any comments or questions regarding the call center? That continues to be an area that we're staffing also as directors. There was conversation on hiring of call center workers, and there was a motion as directors that new staff being onboarded to the call center be onboarded through one zone. So I don't think I wrote down the name of that zone, but it was not Burleigh County, that will onboard those new staff coming in. So I did talk to that director today, and she said out of her 5 open FTEs, she was able to fill 3 today or recently, whether that's offering positions or they're like officially hired on, and then they have additional interviews they'll be conducting. So the efforts was trying to streamline the onboarding for call center workers. Now these are statewide positions though, so she had let me know one of the people that she was onboarding is actually a resident of Burleigh County, and so they'd be picking up equipment through me, but they're employed through that host zone. Additional work they're doing through Department of Health and Human Services, they hired a manager for the call center to help kind of understand the operations of a call center. So they might not have had experience in economic assistance, but they had experience operating a call center. So it just was the idea that they needed to have somebody who understand how call centers should operate, what tiers look like, how they're escalating calls to higher levels. So that effort has also been underway for over a month now. Other things for economic assistance was we also have a new Medicaid director through Health and Human Services. So she was able to come on site on September 19th, meet with my team. They really just asked that a zone bring them in to show the workings of a zone and economic assistance. She was able to kind of look how applications are processed. We had good conversation around barriers with Medicaid, areas we have concern with policy or law that's interpreted, different things like that. So good response. They were able to get back to us with some of the things that we had concerns with, and seeing some movement to correct some of those things, or at least have discussion around them. And then the biggest thing for regarding Medicaid is that public health emergency that had been lifted previously, just continuing for staff to work those Medicaid cases now without that PHE in place. So it's just different. They're processing those as full applications, and so it's a little bit more work for that team to get used to the workings of those cases without the PHE.
I have a question on the Medicaid director visit. Was it, what kinds of things, what kind of changes were you guys asking for?
Oh, boy. Some of the comments we had questions, or some of the conversation we had around was about our systems. It could just be the operations of the system that the employees accessed when they're pulling the information or completing the applications, things that would work better. Really, they just were able to give feedback, which is what I appreciated. There's a lot of times that I don't think we have a voice as the front line of things that are working or not, so we were able to do that. Some of it was policy that could be interpreted one way, and we're getting that feedback from the policy administration department through the state, and maybe a neighboring zone's getting different feedback. So we were just able to kind of air some of those concerns. And we talked about streamlining medical travel, those kind of processes and what people go through. So I definitely felt heard. We were able to say our concerns, and then they had some feedback for us later on conversations they were having with the people who make those decisions. So really, for me, it was just more about partnership. Although we operate as a county employee and as zones, we do rely on the state for partnership when they're administering policy and law and changes. So it was just a good point of contact. Anything else? The biggest thing to talk about with economic assistance would have been a change that with operating as regions, certain regions of the state have expressed backlog in processing their cases. So I'll just kind of give an example of, in the data we were shown was that in our region, so for Burleigh County and those zones I named, we may have a turnaround of applications that could be 2 days, where other regions of the state we're seeing 2 months backlog in that. So what that means is a client being approved and being able to receive their benefits is varying based on their geographical location. And so that's concerning that certain areas of the state are going longer without getting approved for their food versus other areas. There's things that we talked about, which was as directors, such as staffing issues. So is it a staff shortage? So we kind of have been trying to brainstorm around when they have open FTEs within their zone, they have been moving those from zone to zone. So some of those areas of the state have said, if this rural area has better luck hiring eligibility workers, you can have my FTE. That doesn't really matter if you can get it filled. So we've talked about that to try to combat the backlog. We've talked about performance. So those zones should be addressing performance within their workers to make sure that they are working cases that they should be, and what does performance look like. We also talked about just some different things coming up, like the PHE unwinding, as well as the LIHEAP season. So what had, I guess, transpired recently was we rely on some of the department for feedback, and again, that's a huge backlog for certain areas and people not getting benefits. So they had proposed that we open up those groups statewide. So right now we're only operating with our region, and the proposal from the department was we operate statewide. So whether you're in our region or the southeast, northeast, northwest, your work comes into that group and it's worked as it's received. That was the recommendation from the department. Zone directors had conversation around what would work. I will just state that my recommendation was that we take it one group at a time, because again, we operate in the 4 groups. So I just said, can we pick one group to pilot this in? I picture virtual doors, like open up those virtual doors for those programs and allow them to work out some of those kinks, like discrepancies in policy interpretation or performance, and then move to the next group. Ultimately, it was just decided, or it was motioned and voted on that it be all 4 groups at one time, effective October 23rd. And that was the motion that passed. Again, I was a no for that, just because I felt like I wanted to take it one group at a time, allow for that change to help happen a little bit more gradually and planned, but ultimately, they will start on Monday as a statewide operation. What that means as local stakeholders is our constituents are used to seeing that quicker turnaround of 2 days, but now that we're kind of sharing that workload, other areas of the state won't see a 2-month backlog, but we will probably see more, our clients might see more of a wait period as we take on their work. And as stakeholders and people who probably hear from your residents, that would be something that you hear about. Again, that's a go live date of October 23rd. One thing with that I'll say though is the big push is, we want everybody to get their benefits and not have to wait. And as directors, also part of redesign was making the EBT card issuance went to a out-of-state vendor. So that was now you wait for your card to come in the mail, which some people have said could take 2 weeks. It could take months. And so I just don't feel like that part's been going well. So we also motioned and voted as directors that we propose that be brought back to counties to issue those in-house again. That's something we were doing long before this redesign. It's only been 9 months we haven't been doing it, so I don't feel like it'll be a big adjustment. You'll see more foot traffic into the building, but to me, it's serving the clients better. When I have a client at my office who has been approved for those benefits, I can see their benefits sitting in the system, but they can't walk out that day and go get their food. We're sending them to food banks or food pantries, and then we're hearing from those people they're having a hard time keeping food on the shelves. So that was our recommendation, united as a directors association, and proposed back to the department, but ultimately that's their change to make as far as retracting that from that vendor and making it back in-house, so.
Well, and I've heard the same thing, clients wait for those cards 2-3 weeks, 4 weeks, and they can't get food.
Mm-hmm.
And I would highly recommend that, if it comes down to it, we need to push the department, because I hear it constantly at the batters, and I have many that get food stamps, and they say when their card's not working, they ask to get a new card, and then it gets 4 weeks to get a new card.
Mm-hmm.
So I think, it needs to be brought up to the department again. And maybe it takes the zone boards to do that, but it seems to me that shouldn't be an issue.
Yeah, I think as a directors association, we spoke on what we would like. We issued that to them formally so that we kind of know what we're advocating for our local communities. But ultimately, that's their change to make. I don't know. If they don't, then we'll have to kind of keep going forward with probably speaking to our elected officials about that concern we have. So, anybody have any comments or questions about economic assistance? That's really the update I have for that programming.
Question?
Yes.
Is there anything negative about having it in-house instead of third-party vendor?
When you're trying to move forward with like the lessening your footprint, people could argue then you're able to downsize people that you have to have in the building. But not everything can be done that way. Sometimes people need to have client-facing interactions, and we need to get them their food card. That would be a negative for some of those zones who have maybe looked at consolidating their staff. That wouldn't be an issue for our zone, so that wasn't anything I had concern with. Yeah. I just see a lot of benefit to it when I have clients that I interact myself in the lobby and they need food that day. I can give them all the food bank and soup kitchen information, but they can't walk out that day and get their food. Also hearing this from our community partners, right? I attend collaboration meetings and I hear that from school partners when they're trying to support families with getting these services. So this wasn't just like I'm speaking on myself. I rely on the board and feedback from my partners, and I'm hearing this from others too. So it is definitely a change that I would advocate for. And my argument was we can process applications as fast as we want, but we're not having them walk out that door with food or access to food. So to me, they really go together.
And one of the things I'm seeing too is those food banks, they want last resort.
Mm-hmm.
And if they have food stamps, I don't know how they can justify them getting that.
Mm-hmm.
Because of a state thing. I don't, they've been nice about it, I think, but I know they're supposed to be strict on that too. If they have food stamps.
Yeah, and one thing we talked about, and again, we're invested in our community, but as you look at the entire state of North Dakota, there's some areas of the state that don't have those same resources we do with food banks, and so they are more limited in getting those things. So I think that this was the better decision for those that we serve. So okay, that's all I had for economic assistance. If there's no questions. We will move into the child welfare update. So this one, you received the child welfare report that kind of goes over, and again, if you have feedback on how this should look, we have been trying to find different ways to provide you this information that you would find helpful. So one thing we did was talk about, like the CPS assessments, the number of open assessments, how many new ones would have came in, and this was for, as of September, like for that month. Cases that we closed. And then one thing that we look at for performance improvement is the average days from opening to closing of assessment. So 64 days is the mark we're hitting. The recommendation out of policy for child protection assessments is 28 days. Sometimes you can hit 28 days. Sometimes cases need more time than that. Sometimes it's the capacity of cases that we have. And the number that we have coming in. That unit at full staffed has 10 staff, right? We've been operating with 9. So sometimes that has a little bit to do with it, with the number of caseloads they're getting. The case management services, that just kind of goes over the number of youth in foster care, and then it breaks it down from there, the number of youth in our care that have the termination of parental rights. Most of those kiddos we're working on the adoption portion, so they're probably in pre-adoptive placement, or we've identified who is going to adopt them. They got to go through the home study, but there are some youth in foster care who we're doing recruitment efforts with, that we're working with Ask to do some different techniques to recruit family to adopt them. So we also, as directors, the Adoption Department of Health and Human Services presented some new things they're doing, and they have this thing called Reel of Hope, where they're working with kids to create a reel, like a little video about themselves through that recruitment effort. So they're trying to get creative with some of those kiddos who maybe don't have an identified family. And then they count for youth coming into the program and out of the program. So that's good. We're seeing children be able to either be permanency one way or the other, whether it's reunification or adoption. And then the number of youth receiving in-home services. So down below, we just kind of outline things that we've been working on. So we've been working with the director of, through the public schools, with Tracy, retired from her position. So we've been working with the director of special services and assistant director they came to our all-staff meeting and talked to our child welfare staff about kickoff to school, getting kids enrolled, make sure they're correct in the Power School program for the right home jurisdiction, because kids moved possibly throughout the summer. One thing that I'm working on them with is some transition planning. So when I have a kiddo who is going to be transitioning either from a Bismarck home to maybe a home in Dickinson or anywhere else in the state, or you might have a child who is placed in a facility such as the DBGR or a Manchester, and you're going to transition them back into their public school in their community. What does that look like? So we've been really working on trying to have a better process for transitioning. Well aware that some of our transitions are abrupt. They may be an abrupt removal from a home or a facility, but some of them we do have the ability to be more planful. So just trying to have better collaboration on that. We've done work with the Foster Parent Association. So right after our last meeting on the 15th, I cruised over to their picnic. That was great. I don't know, Leslie, if you have numbers for how many people attended or anything, but
I mean, I do someplace, but not in my.
yeah, no, that's okay. So that picnic was great. It's just an appreciation for foster parents. So I had a handful of staff that provided support with serving the meal, cleaning the meal, helping the families, helping the children at the amusement park, because that's where it was held at. So it was just great to see that collaboration as well. We've also participated in 2 of the Foster Parent Association meetings in town. So in September, we had a panel that provided bio-parent support. I was able to sit on that panel. Really what that was about was talking about how foster parents can support bio-parents and how we see a successful reunification more likely when you're building that connection with your bio-parent. We also talked about cases where that might not be an option, and what does that look like. They had a foster parent on that panel as well, and she was able to share her experience, so that was good. And then at their October meeting, we spoke about teenagers, so dealing with those tough teenagers, what it kind of takes to work with teens, what is to be expected, and some of those tough conversations that come with teenagers. One thing I think is really important to note for anybody who is watching and is interested in foster care, people commented that teenagers can be easier because they can communicate. It's bigger kids, bigger problems, but better communication because they can verbalize their thoughts and feelings a little bit better than some of those younger ones. So thought that was an interesting perspective from those foster parents. We have also continued collaboration with the schools. We meet monthly with them to consult about services for child welfare and collaboration efforts. For me, the bigger thing is we focus so much on what we do once children enter our child welfare system or we get to that level, but there's not a lot of conversation around prevention. So for me, the point of the collaboration meeting, not only just partnerships between our agencies and sharing our resources and supporting each other as professionals in that effort, but what could we be doing to be more preventative? If there's things that we could be offering families to keep them out of our system, what would that look like? So those have continued. We started those last year with Tracy, and those efforts are continuing into this school year too. We also do collaboration meetings monthly between like Bismarck Police Department, West Central Human Services, our service center, juvenile court, just talking about what we're seeing, themes in our community. So out of the last one, a big one we talked about was vaping and tobacco use in the schools and combating that. So it's just a nice conversation about what we can be doing. And then also the need for some crisis services. We talked about the work of the CHINS unit, accessing services more timely. Those are things we have a conversation about in almost every meeting I'm in, just the need for that in our communities. We have multiple staff that participate on statewide committees or task force. So a lot of that came out of legislative. We talked about this last time, but just the kinship and the adoption redesign. I don't have like specific updates on where they're at with those, but just good conversation on, one thing I know they talked about was in the kinship program, an identified relative could almost complete like a lesser version of becoming a foster parent, like a mini version of that, to be licensed almost or certified is what they're referring to it as through kinship, and then they can receive some additional funding or support. So that's huge because we want to keep these children with their identified kin. We have assisted the state in providing support to Cass County Human Service Zone. They have staffing shortages within their agency, which has huge backlog in specifically their child protection unit. So we were able to send out in September, the first 2 weeks, I sent a CPS worker for 2 weeks. She'd come back on the weekends and recharge, and then she'd go back out again and work cases. And then we rotated another worker the second 2 weeks. And so during that period, they worked anywhere from like 20 to 30 cases. If there was anything they weren't able to finish, we handed that back to Cass County if there was like a little bit of follow-up needed or another visit. But on average, I think they did about 30 cases that they were able to help Cass County with. So I just wanted to note the efforts that those workers are making for not only the children of your jurisdiction, but just really looking at these as an investment in North Dakota statewide. Continued collaboration with our juvenile court office. We have our child welfare manager who meets with the department as part of a continuous quality improvement group. He's part of the southwest area of North Dakota, and so when we were talking about CQI, really he's explaining to me they're in the planning phases for that charter. So what is the vision, the mission, who are the stakeholders for quality improvement for our child welfare work? There's the 4 regions of the state that are working on it, and then the stakeholders identified so far are Human Service Zones, Department of Juvenile Services, so your DJS, Health and Human Services, Tribal, and they're engaging with like the CAC, so just some stakeholders in our work. The big push is they would like engagement from people with lived experience. They really want people who might, you don't want all the good stories. You want to know the issues and concerns so we can help identify barriers and gaps and improve. So working on recruitment for people with lived experience for that, that group. And then we've also been working with our interns, our local schools, our colleges, so University of Marion, Minot State University. We've had staff go to those colleges and speak to their classes on what is child protection, what is child welfare, and then also working to recruit an intern. We usually get quite a few people who are interested in interning, so just trying to make sure we're finding somebody who would be the best fit for the work that we're doing. Good conversation I think we had with them about when we are getting interns or staff who don't have experience and they're a newer graduate of a social work degree or another degree, some of the shock that we probably give them to the work that we do. So just was able to provide feedback on things they could be doing in their curriculum to help prepare those students for the workforce. I still have a few more, but anybody have comments or questions yet before I just keep going?
For your interns, what's the target for what year in their studies that you're hoping to get?
Yeah, good question. So most of them are like their end of their year, like they're on their 4th year. There are some that do an internship at their 2nd year. So we talked about we could take them at that point too to see if they're interested in moving forward. Could they intern in my case management unit and then move over to, if they choose to come back for their 2nd internship in my CPS unit, possibly. But most of them are at their 4-year mark. And I think it was University of Mary that says that they do have a course that they do on like, I'm going to call it like fatigue or really building like resiliency. So that was really nice to hear from them that they're having those conversations with their students before they even hit the workforce. They're trying to build that resiliency into them. We've had collaboration meetings with our neighboring zone, 3 Rivers Human Service Center and DJS regarding gaps in resources. And this is specific to your our respite shelter care bed. So typically like Youth Work served as that crisis spot for us. We could use them as our certified shelter. They didn't, I think it was end of last year, they dropped that part of their contract. The state has come back with an increase in the amount that they pay. So what was previously happening is they were just paid to be that bed, and now it's you get paid for services rendered, right? Like if a child is in the bed, you receive that money. So we're still looking at a vendor who would be interested in doing that, because right now in our area we don't have that bed for us to use. So if we have a child who's in need of that certified shelter, we're reaching out to Youth Works up in Minot. That would be our closest one to say, can our kiddo come up there and stay for 7 days to 14 days, depending on the need of that kid. Talked about meeting with asks. As far as recent training for our staff, we had human trafficking. Bless you, Trevor. Human trafficking training that was recently available to staff to attend. Some of this was like social media awareness for our youth. I mean, a lot of our teenage youth could be at risk for being exploited in traffic. So it's good for our staff to know when they're having conversations and building rapport with those kiddos, like what is safe online interaction. And then also next week you have the behavioral health conference. So we'll have staff attending that as well to just get more information on what's available. Other efforts, this time of year, we're working on our Christmas planning. So we work with Open Your Heart, Care and Share, the Angel Tree, and then some different agencies in town that have reached out and say, we want to help. How can we help? We've been able to create like a different, kind of like an organized system for what families are in need of what. And so we have one person who heads that. So we will be actively working to get gifts out before the end of the year. So. Otherwise, I think the biggest thing that I wanted to make sure we shared about child welfare was we were previously on a performance improvement plan for completing the face-to-faces for our federal guideline for the children in foster care. That doesn't mean those kids weren't being seen. It just could mean that we didn't have timely entry of that data. We had staff turnover, and this, again, I started in June, I think 2022, and so that improvement plan was for that, like previous to my tenure, like starting here. also a lot of that could be attributed to staff turnover. If we lose a staff member and they haven't entered those notes, it's hard to go back and speak to visits that they did. So we had been on that performance improvement plan. This would have plan ran through October 1st, 2022 to September 30th of 2023. So we just met end of that federal fiscal year. And the goal is a 95% of a face-to-face, and we hit 97%. So those staff worked fast and furious those last few months to get everything in and make sure all the kiddos were seen. So that was a huge win for that team, and we celebrate them for making that a priority in all the work that they do between transports and their court hearings and their meetings with their families. That's it's not always the urgent work of entering and paperwork, but it's important work. So as far as my case management unit, they have 9 positions when they're full staffed. They only have 8 right now. I wanted to just note 4 of those 8 staff are under 6 months for employment. So, and even of those 4 staff who are under 6 months, they're still carrying caseloads that are, I think like the highest was 14. But of my long-term staff, and by long-term, year to 2 years, their average caseload is at like 25. And that's children per their caseload. So, and then for our in-home unit, they also carry some foster care cases to help with the load, but really just wanted to note that that unit has gone through a lot over that last year. They have a new supervisor who just hit her year, and they have 2 staff on their team who are under a year. And so they've done a lot of good work this last year trying to just onboard, get familiar with policy, the framework that we operate under, become experts in the work that they're doing. So kudos really to all the workforce. Any comments or questions about anything else for the child welfare unit? And again, any data that you want to see done different, just let me know. You have the visual as far as where our caseloads are trending. Parent aid services would probably be the one you're going to notice. We had quite the drop in that. That is probably the one service that we can do based on staff capacity. The rest, you can't prevent the cases coming in through child protection or foster care case management, but parent aid, if we don't have staff, we don't assign a parent aid to the case. So we did see turnover in our parent aid unit towards the end of the summer, and so that caseload dropped, but we are onboarded somebody this week, and we have a position pending, so hopefully we'll see that service pick up. Other thing that we did in child welfare, I should note, is we did that on-site case review where the department came in and they did like consultation on our cases. It's not a quality assurance. It's really helping my staff take a deep dive into the case. Again, with all the turnover, you might have a case that other people have been working, and it's just a lot to learn the dynamics of. So they really helped the staff dive through the case. And this was to cultivate partnership with the department, inspire this. I'm just kind of reading what the mission and the purpose of that, inspire them to understand the principles of the framework, discover strengths and challenges within our zone so we can build upon those, build competency and confidence in them, grow them in their decision-making and skills, and then support timely permanency. So we found that to be very helpful. I think we're the only zone that's taken advantage of that as of now. As far as any reports that I've received, they might be working with other zones, but I think that was a great experience for my staff. And they did report that too, so I'm not just telling you that. They did tell me that. All right, next on is just other zone updates. So at that point, I just wanted to go over staffing. So right now for open positions, like I said, for child welfare, we have an open position in our child protection team. That position has closed. They're working on setting up interviews. We have an open position in our case management team that should possibly have closed or is closing very soon here. And then as well as that parent aid position for our child welfare unit. So 3 of those FTEs in child welfare, and then we have 1 FTE in eligibility. That's for a support specialist position, monitoring emails that come in, scanning in documents, uploading documents into the system. That was initially advertised within our zone. We went through the interview process, was not successful in selecting a candidate for that, so we did open that to our region. So we'll be hopefully securing applicants, from around our quadrant, so. Any questions regarding that? Next on the agenda is public comment. No, nobody to comment. And then any other business. I don't have anything else for that, Tan. I didn't know if you had anything I missed.
No, I don't have anything else.
Okay. Anybody have any other questions? Okay. If not, then we'll adjourn the meeting. Thank you.